as we saw yesterday, there are segmental spinal instrumentation and there are non-segmental instrumentation. So based on the documentation, you have to code the add-on code. Okay, here add-on code only you will take, not the primary one. Next comes to bone graft. Here again you have to check whether it is autograft or allograft. Again here it is also add-on code. So based on the type of graft they have taken, you have to use the add-on code. So these are the 4 set of code you are going to use in a surgery, spinal surgery coding. And each of the procedure, like as we discussed today, we will just see the practice question, so you will get more clarity. So first, the tips, as we have saw the tips, decompression. Here we will check what kind of procedure they are performing, laminectomy, carpectomy or discectomy. Then again comes to fusion, which is arthrodesis. Here you have to check anterior or posterior. Instrumentation, here also you have to check segmental anterior, segmental posterior, or non-segmental anterior, non-segmental posterior. Okay, those approaches you have to check. And based on levels, based on level is like how many vertebra they are utilizing to do the instrumentation. So you have seen in the code like 3 to 4 vertebra, 3 to 8 vertebra, that vertebra specifications were there. So if you have getting L1 to L2, L3 and all the 3 level, if they are inserting instrumentation, then you should understand they have utilized 3 vertebra here. Okay, based on the vertebral specification, you have to take your instrumentation code. Next comes to bone graft. So discussed allograft, or in the allograft, structural allograft and autograft. Autograft is something they are taking from the patient own body. They are taking the bone from maybe patient's iliac, the crest. And then coming to allograft, here it is like structural bone, okay, structural or morcellites, they'll take it from under allograft. So now just see the common conditions you can see for herniated disc, spinal stenosis, and so next is burst fracture and spondylolisthesis. Vertebra slips forward, causing the nerve compression. So you can see here, this is what making a, or one nerve is sitting on another nerve. Okay, it is creating a pressure. Okay, so vertebra slips forward, causing nerve compression. In order to release this nerve pressure, they have to perform the decompression procedure. So firstly, I'll start with the questions. We have many questions here. So let's read the question and understand. So you can see here, so Sally suffered with a burst fracture to her lumbar spine during this hiking, okay, accident, and Dr. Phillips performed, like what is important that I'll read. So doctor performed partial carpectomy to L2. Okay, L2 means, what is your understanding? What is the lumbar? Okay, so they did partial carpectomy to L2 by transperitoneal approach. Okay, so approach is also important. They did partial carpectomy to L2 by transperitoneal approach, followed by anterior arthrodesis of L1 to L3. Anterior arthrodesis of L1 to L3. So how many interspace are there between L1 to L3?
1.
L1 to L3.
2.
Interspace. Okay, 2 interspace are there. Next, she also positioned anterior instrumentation and placed structural allograft to L1 to L3. So on that particular L1 to L3 site, they did anterior instrumentation and also they placed a structural allograft. Okay, so all 4 procedures are here. How would you report, doctor? Services? Okay, so check the options. These are all very important questions. Okay, if you take 8 mock, out of 8 mock, you can see this question in 4 to 5 mocks. Same question. So You just, take some time and go through the option and see what is your answer. And I already told you modifier usage also. So by knowing the modifier usage, you can analyze and you can type your answer. If you have practiced, I think I have sent the practice question already. So I don't know it is there or not in the practice question, but these are mock questions. So please take 1 or 2 minutes and type your answer. First, you can go to decompression and see under decompression. You can go by option. Okay, so you eliminate option C and D. Easily you can eliminate because they're talking about the decompression, but you don't have the 6 series code. So easily you can eliminate option C and D. So now just cross verify between option A and B. Okay, so many of you gave the answer, which is correct. But see how easily you have navigated the answer. You got to know the modifier importance and you got to know the hierarchy. Like after decompression, the arthrodesis will come, and after that where you have to append your modifier. Everything you are aware before going to concept. So easily, without taking 2 minutes of time, you can lead your answer to option A. So why we can't choose option B? First thing, like even without seeing a CPT description, you can eliminate option B.
Because in it the approach is different. It's trans-3DL approach.
No, see,
59 modifier.
51 is used where? It is used with add-on code.
Add-on codes do not have modifier 50.
Okay, so 51 modifier is with the add-on code they have given. So by seeing that, you can eliminate option B also. So option A is correct, and let me show the code description. So first, since they have performed partial carpectomy to L2 by transperitoneal approach. See, you will have this question, like one question they may mention as partial carpectomy to any one vertebra like L2, L3 by transperitoneal approach, and one more approach we have, that is thoracolumbar approach, both thoracic and lumbar, thoracolumbar approach. So these are the two different types. Okay, so we have to check and then you can take the code. So we'll see this. So you have option 63085 and 63090. So you can see 63085 is vertebral carpectomy, partial or complete, transthoracic approach with decompression. Okay. 63087, vertebral carpectomy, partial or complete, combined thoracolumbar approach. Next, 63090, vertebral carpectomy, partial or complete, transperitoneal or retroperitoneal approach. Okay, so you got transperitoneal approach, and here we have the carpectomy partial. So the decompression code is 63090. Okay, so next we have 22558 and 22585. These two codes are Arthrodesis codes. Okay, and as you can see, between L1 to L3, there are two interspace. So first, this you are coding Arthrodesis for lumbar initial segment, and then you are utilizing 51 modifier, and 22585 is an add-on code for additional interspace. Okay, next which procedure will come?
Instrumentation.
And here anterior instrumentation they have performed, and when they specify L1 to L3 and they are not anywhere mentioning that they did not insert to maybe L2, like that they are not saying. So they are just specifying it as she also positioned anterior instrumentation and placed a structural allograft to L1 to L3. That means with all the segments they did an instrumentation. Okay, so it's a segmental. So for segmental instrumentation, what is your code and how many segments we have here?
Two.
Two segments. No, L1 to L3, how many? 1 minute.
Three segments and two
Three
spaces.
segments and two interspaces.
So 3 segments are there. 22845. For description, we can check. 22845 anterior instrumentation, 2 to 3 vertebral segments. So this question is about, or the description is about vertebral segment. So between L1 to L3, you have 3. So anyway, you have the range of 2 to 3. So 22845, you can select as your add-on code. So next thing is, the last thing is, we have bone graft. And what kind of grafting they did? Structural
Allograft.
allograft. Okay, so structural allograft, the code is 20931. So you can see 20930 is allograft morzalized, 20931 allograft structural. So you can select 20931. Okay, so the first question answer A is correct. So whoever not given answer, so please take your time and navigate the codes. You can also able to understand and you can able to give your answer. Okay, so next question, another case study. So here there is no decompression, okay, which is other than decompression. They are performing arthrodesis and further like arthrodesis, instrumentation, and then bone grafting. Okay, so please read the question and you can type the answer. So you should also understand when question is too big, okay, you should once in a glance you should able to highlight